Now let's begin with our fifth section, in which we will talk about the induction of labor. In this section, we will talk about the pain relief during the labor or induction of labor, and what is induction of labor, and what are clinical risk management. Pain relief in labor. Advising the best mode for the relief of the pain is usually based on if mother is nulliparous or multiparous. So the parity plays an important role in defining or advising the best mode. Current cervical dilation is another important mode. And then what's the rate of progress of labor? Extent to which pain is felt. That's very important. If pain is unbearable, usually something should be given to relieve the pain. But if it's bearable and it's not that bad, then let the process progress. Analgesics which can be used for the relief of pain. We have narcotic analgesia, then we have inhalation analgesia, non-pharmacological analgesia, and regional analgesia. The narcotic analgesia is pethidine, which is narcotic agent, morphine, and opioids like remifentanil. Then inhalations analgesia, which we can inhale, is Entonox 50-50 mixture of nitrous oxide and oxygen. Then we have non-pharmacological analgesia, which include transcutaneous electrical nerve stimulation, non-invasive like acupuncture, sterile water injections, and massage. These are all means of non-pharmacological or without any medicines. And then regional analgesia is epidural anesthesia. All these can be used for the relief of pain in the labor. Epidural anesthesia, insertion of IV cannula and preloading with saline Hartmann solution. So IV cannula is inserted in the vein and it's preloaded with saline and Hartmann solution. Then insertion of epidural cannula and injection of local anesthetic. This is the injection of local anesthetic between L3 and L4. Monitor blood pressure, pulse rate, and fetal heart rate and adjust the maternal posture. Epidural anesthesia can cause some complications. Example like low blood pressure, hypotension is possible, like 90 to 60 millimeter of mercury. It can also cause accidental dural puncture. Accidental puncture of the dura mater. These are the layers of the meninges. We have pia mater, arachnoid mater, and the dura mater. So accidental injury to dura can occur during the epidural anesthesia. And another, it can cause postural headaches. Postural headaches is headaches which occur when the positions are changed or when the patient sits or stands. So these are the postural headaches. All these are the complications of epidural anesthesia. It's done in between lumbar 2 and 3, and anesthesia is given. Complications can be low blood pressure, injury to the dura, and then the postural headaches. Induction of labor indications are a prolonged pregnancy. If pregnancy is prolonged, if it is after like 41 or 42 weeks already and the normal process of labor is not beginning, then we should do induction of the labor. If there is preterm rupture or pre-labor rupture of membrane, induction of labor should be done. Preeclampsia, fetal growth restriction and macrosomia, and also deteriorating mental illness. All these conditions can lead to are the indications for induction of labor, and induction should be done. Then induction of labor, other indications include diabetes, antepartum hemorrhage, twin pregnancy, maternal isoimmunization, and also intrahepatic cholestasis. So all these are the indications for induction of labor. Antepartum hemorrhage, diabetes, twin pregnancy, isoimmunization, in which we discussed in one of our lecture in detail, like incompatibilities, RH incompatibilities, that is also indication for induction of labor. So these are different conditions in which the labor should be induced. Clinical risk management. Its aim is to improve the standard of care and reduce harm occurring in women and their babies. It's very important, even in this age and this time, there are so many maternal mortalities and maternal morbidities and fetal mortalities, morbidities, due to poor clinical management in the during the pregnancy. So it's important that we should improve the standards of care during the pregnancy, and these include some legal action should be done. If the care is not properly done, and it can cause poor outcome of the pregnancy because of the ignorance and poor care, legal action is important, that they should be accountable for their action. Then staff education guidelines and protocols are another important management steps. Then next is the root cause analysis. The root cause of the poor outcome of the pregnancy is important. Where the things went wrong is important. So we should take special precaution, and we should take steps to improve the standard of care and remove that root cause. And then audit of the wards is important, because without audit, nobody will be, in future, they won't take any care, and they won't improve their standards, and they won't improve their management unless they have proper audit or proper, they should have proper audit of the wards if their management steps are good or not. So all these include in the clinical risk management to improve the standards of the care and to reduce the harm that occur to the mother and the fetus or the baby during the delivery. Thank you for watching sqadia.com.